Authorities in Hong Kong are imposing their toughest restrictions since the start of the pandemic as infection numbers explode. Most venues, including schools, gyms, churches and hair salons, must close. COVID-19 cases have almost doubled to hit a new record high.
Hundreds queue to get tested as Hong Kong prepares for some of its toughest COVID restrictions yet. As many countries shift their approach to living with the virus, Hong Kong is pursuing a zero-COVID strategy, in line with the Chinese mainland. But a sudden surge in cases is complicating matters. The government responded by announcing tough new restrictions on Tuesday, closing hair salons and banning public gatherings of more than 2 people.
At this moment, we still feel that this is the best strategy for Hong Kong, using all our capacity and our means to ensure that we could achieve the dynamic zero target.
But the announcement of new restrictions and disruptions to imports have caused food prices to skyrocket. As fears of a shortage grow, residents are feeling the pressure. Some have begun to question whether the city's zero-COVID policy is worth the damage that it's causing.
Now, all the restaurants are closed and everywhere is closed, and the economics already getting big impact. So, I guess living with the COVID would be the best solution and the easiest way.
I think definitely it's going to follow mainland, right? Because it doesn't have any other options. So if mainland wants Hong Kong to continue to lock down, then Hong Kong has to lock down.
For now, there is little that Hong Kong's 7.5 million residents can do but wait and hope that case numbers begin to fall as soon as possible.
For more, let's bring in our correspondent Phoebe Kong in Hong Kong. Phoebe, what's the latest on these tough anti-COVID restrictions?
Well, Hong Kong now is suffering from the most severe outbreak since the pandemic began in 2020. It's the 5th wave of infection in the city. Over 1,000 cases were reported yesterday, and another 980 cases are reported today, hitting a record high. So there are mass testing being conducted across Hong Kong. As I'm standing here next to one of the testing stations, we can see long lines queuing up to wait for testing. People have to wait for hours, up to 6 hours, to conduct the compulsory testings if their residential areas were detected virus or infection. So starting from today, the government is imposing the most draconian measures since the outbreak began, and that public gathering of more than 2 people and a private gathering of over 2 families are banned, and also a series of stringent measures that hair salons and religious venues like churches and temples have to be shut. The government is also laying out a vaccine pass in 2 weeks, requiring all citizens, people in Hong Kong, will have to show their proof of vaccination to enter many private venues and public facilities. So the government is really trying every means to eliminate the virus from the community.
How are Hong Kong's hospitals and critical infrastructure faring in this current wave of infections, Phoebe?
Well, seriously, that is a pressing problem facing the Hong Kong government. That, according to the authorities, the occupancy rate of the isolation beds at public hospitals is reaching 90%, and the emergency wards are also getting overwhelmed. So, public hospitals is really running out of resources to accommodate new patients. When we're talking about over 1,000 patients getting infected every single day, and so the government is now trying to transfer some patients with mild or even no symptom to some makeshift isolation facilities in a bid to ease the burden on public hospitals, and also eyeing on hotels to accommodate new patients. Some experts even suggest the so-called reverse isolation strategies, hoping to accommodate the new infections.
Now, critics say that China's zero-COVID policy, which now applies to Hong Kong, is doing more harm than good. What's your impression there?
Well, there have been debates on whether Hong Kong should stick with the so-called dynamic zero-infection policy adopted by mainland China or not. Some experts and economists suggesting that such policy is not sustainable, especially when Hong Kong has already paid a huge price to contain the virus for 2 years, that flights are down by 90%. Many shops have to shut and close down, and some financial rating institution even lowered Hong Kong's GDP growth forecast this year already. So such policy may compromise Hong Kong's position as an international aviation and financial hub. But on the other hand, Hong Kong's Chief Executive Carrie Lam still insists on sticking with the zero COVID policy. She thinks this is still the best option for Hong Kong because more than half of the elderly haven't been vaccinated. So that's why it's not suitable for Hong Kong to live with the virus as the rest of the world is doing so.
Phoebe, thank you. Phoebe Kong there in Hong Kong.